coming back to the Lady Leader series webinar. We have Amy Maryhugh back with us. She was such a huge hit for the last hygienist webinar that we did. I got so many really great responses from doctors and team members who were so excited, I think, to just hear from a hygienist who, like I said, you know, is this amazingly high producing 3.3 times her pay, actually over. And she's a six-figure salary hygienist who does that. And it's kind of neat, I think, for other hygienists to see potential of what can be done and the work that goes into making it happen. So I decided after I got so much good response, I was like, gosh, I just have to let her talk some more. So I did get some questions and points from doctors and team members who said, have her tell us more about these things. So that's what we'll be talking about today. So yeah, Ashley, I think you can attest that right now with hygienists, it is just a hot topic, isn't it?
It is a hot topic because they are hard to find. And then the ones you do find aren't necessarily quality, or, you know, just kind of need that extra boost of either motivation, maybe training and confidence, and just even how to talk to patients. So, you know, with the workforce kind of across the board in any position is limited, and hygiene is even especially so. So Amy, we are grateful to you for being on today. And as Summer mentioned, definitely lots of comments, lots of questions of, you know, hey, you know, we still have these questions, like, and so that's why we wanted to have you back.
Yes.
Thanks for having me.
Yes.
Yes.
So I think the first question that I got that I know actually, this is kind of Amy's zone of genius, I find, is she's really emphatic about the level of preparedness she has for every day with her patients. And I got a lot of questions of like, knowing that's your number one weapon, Amy, to like get yourself not just to production, because I don't even know if you think like that. I think it's more so it's your number one weapon to truly having the biggest impact on your patients for their health. Explain a little bit more to everybody, what does that time of preparedness, what does that look like for you?
So I think that it can be done in the morning, you know, before your day starts, if you don't have time the night before, or you can do it the night before, but the time is not productive time. So we're not actually producing in those moments that we're prepping our charts or we're looking at our day. But I think it is such a huge key to making those appointments, just opening up the opportunity in those appointments to do as much as we can when the patient's here. And, you know, it gives us our best possible potential for adding same day treatment, looking at past perio charting, like, could we maybe utilize the 1 to 3 SRP code that day? You know, like there's just so much that if you wait until that last minute before your day starts and you're just kind of willy-nillying it through the day, you're gonna miss all those little possible things that you could add. It's just, I can't emphasize enough that pre-appointment planning is crucial, and you have to spend the time. But in saying that, we're not producing, so as hygienists, we've got to be efficient in like figuring out where to look for these opportunities and doing it quickly but thoroughly, and doing it before you're actually in the moment. Because if you wait until you're in the moment, you're probably not going to do it. So I think before the day ever begins, you want to know exactly what that patient is due for. And then you also want to identify areas that you can add something, you know, whether it be, you know, the 4346 code, the obviously fluoride. I think I emphasized that in the last webinar that pretty much all of our patients could benefit from that. But there's so many other little things too that I think if you're not looking at past notes, you may miss. So
Absolutely.
And I would say probably for me, it's a 15 to 20 minute time that I'm putting into that. But I know, you know, where to go to find the information. My past note is pretty thorough. And I also kind of noted areas that we're monitoring. So I'll know if we need to check an incipient lesion on, you know, the right side, or, you know, they had a lot of bleeding. We had that conversation that, you know, if your home care doesn't improve this by your next visit, we may be adding the laser, or, there's just so many opportunities that you can be pre-planning even in the appointment before. So
yeah. Oh man.
mhm.
I'm like, what's funny is I'm like, I think she makes it sound so easy. And I'm like, what's amazing about her is, and what she has taught really all of our hygienists is how to utilize that level of preparation and really be such a good steward of that time. And, I tell doctors often, it's like, it's hard to want to pay for them to not be productive, but I feel like if they're doing really right by the patients, yes, you're paying for that time, and it can't be unlimited, don't get me wrong.
Sure.
Like she said, 20 minutes should really be all it takes to kind of wrap the day up, but then also prep yourself really well. I feel like the ROI on that is huge. And I don't mean to gloat over her quite as much, but like I have to just say, like, over and over again, she comes to the morning huddle and she says, so I have an opening here. I have this here. My day's starting at 14:57. And she said, but here's where I see opportunities almost every time, almost consistently. And it just happened. 14:57 turned into 20:53 by the end of the day with an opening in the appointment. And like her level of preparedness has truly made it to where when she gets in that appointment, she knew where that hole was. The person before needed SRP, or needed a little bit of 1 to 3 potentially because of her last notes. So she had it ready. She was like, TCs, here's the treatment plan, have it ready. She got into that and she's like, I'm just going to do it today. And I just think to myself, like, it's because of her being so prepared. It's because of spending that 20 minutes and being so diligent. She knew that those opportunities were just waiting. And she was, like you said, you didn't walk into that appointment and you were frantically trying to quickly look at the notes and see what needed to be done. And that's where then I think just missed opportunities walk out the door. And that makes a ripple effect of it being so much harder on everybody on the team. You have to reactivate that treatment. You have to, call the patient to come back. When it's so much easier for the patient if you can just do it for them then. So
it's like that ounce of prevention is like this, so that ounce of preparedness, like just taking that little bit of time, like really expands into, like you said, the waterfall effect on the team and kind of the whole day. So I think that's really important to remember, like you said, because sometimes it's hard to think of non-productive time as productive, but it's kind of allow it. We have owner dentists here too. Sorry, I'm kind of rambling, but with regards to working on the practice and in the practice. So you kind of have to have your team help you with that as well. I think that's amazing.
Yeah, absolutely.
And I think we've gone through different systems of like how we're gonna look at our day and how we're gonna write it, how we're gonna remember what we actually found as those potential things that we could add. So I think I started with route slips and I was writing little notes on the route slip. Now I've got, and then we went to like a column based, just one form that we would put the patient's name, and then I'd have all these different columns of like, are they due for x-rays? Did they have 4mm pockets? I don't know. There were just,
sure.
You can add whatever column you want. And then now we've even taken it to make it even more simple. And it's, it's just, it's a work in progress. And I think you have to figure out what works for you and just start implementing it and just try different things, because I think it might seem really complicated in the beginning, but now it's just like second nature and it's quick. I don't feel like I spend a lot of my day or my time doing it.
Yeah, so it might take a little bit of, once again, work on the front end to figure out how to chart prep effectively and what system. Like you said, we've gone through a few different revisions of how to help hygienists. And Amy's really good as a lead. She's really good about saying, hey, these are some of the ways we do it. Pick which one resonates strongest with you, but we have to get this level of preparation done. And so, yeah, I think that's a really important point. And I don't know, Ashley, I truly can't remember if we posted. Amy simplified everything even more to where her morning huddle prep sheet is on top of her end of day checklist. So I don't know if we included that, but we can actually add that to this as well if people want to see kind of Amy's simplified form.
Sure. I'm sure they would love that.
Yeah, we'll be happy to do that. And then one question that I got over and over, every call I took, every like little message I got, almost all of them asked, okay, Amy, so you talked about, your 60-minute efficiency of the 20-20-20-minute assessment. And then you've got, for us, 90-minute new patient appointments. And people kept asking, like, no, really, like, what does she actually like do in that 20 minutes? And if you have that do. So I thought, instead of me saying this over and over and over, I was like, I think I'll just bring Amy back and you can kind of explain what you do. And then this is another form that we can include as well that Amy will kind of post for everybody too. But
yeah, we have a breakdown of like a 60-minute appointment, like a recall patient, and then the 90-minute new patient one. And it kind of breaks down the timeline a little bit more in detail. But I will say that truly, I don't do much different between a recall assessment and a new patient assessment, other than obviously the new patient, it's going to be a little longer because I'm charting more. I'm starting from scratch basically. But we did kind of as a team develop an exam sheet that kind of hits all those areas that we want in that comprehensive exam, and so that we're making sure as we're going through the assessments that we're kind of checking off all the boxes basically to ensure that we're getting all that information that we want on those new patients. And it's just a reminder, because I think sometimes you get, maybe my husband calls me a squirrel. I get off track sometimes. So like it just helps keep you kind of focused. And I won't say that like I feel like I'm working the whole time. Like there isn't a lot of time to just like, like as you're taking intraoral photos, you're speaking, you're trying to get to know the patient, but you're working as you're doing. If you don't do that, which in the beginning I didn't do that, and so I would talk way too much, and then I would try to cram it all in, and it just doesn't work. So you have to figure out how you can work while you're talking. But for the the comprehensive exam on new patients, I would say that one runs more 30 to 40 minutes of just assessments. And in our assessments, that includes like a full mouth series of x-rays and oral cancer screening, charting existing restorations, intraoral photos or a wellness scan with the iTero, perio charting, that's charting bleeding, recession, everything. And then actually taking a moment to kind of co-discover with the patient what you're seeing. And that you kind of want to have wrapped up. And as you're doing and gathering all that information, you're kind of talking to the patient about what you're seeing. You're not diagnosing, but you're at least telling the patient what you're seeing. We owe that to the patient to tell them, even though we're not telling them what they need, we're saying, if there's a cracked tooth or if there's a lot of bleeding with probing, just we're having those conversations while we're working. And then in a recall, it's basically the exact same thing. The only difference is I'll alternate between x-rays and full mouth perio charting, because each of those will take a little bit of time. So if they're due for the perio charting, that's what I do that visit. And if they're due for x-rays, that's what I'll do with that visit. And then again, we review the findings with the patient before the doctor comes in. And then I think we mentioned this in the last podcast or the last webinar that we let the doctor know that we're ready for the exam after we've kind of had that conversation with the patient. And then you start kind of working. So
yeah. And I think that it's really important. Like I know for some hygienists, that's actually kind of a new concept I discovered, that, really taking that first 20 minutes to do that really thorough assessment, it's almost like, once again, a level of preparedness. Sometimes I think we dive in too quick and we've missed things. Yes. And I know that there's been, and this was a long time ago, we dove in too quick. We missed perio opportunities. You start cleaning without really looking at everything. And so I think that, a lot of times it's like, is it really worth that time? The ROI on them doing a thorough 20-minute assessment, it pays off in so many areas, and the patient we get, Google reviews constantly of like, I've never been taken care of so well before. My hygienists have never cared about me as much as these hygienists do. And I think it's important for the patient care. And I think it's, really if you want to, bring it down to numbers, like it helps all the numbers of the practice when you just do this 20-minute assessment.
And I think, as hygienists, we need to remember that we are getting the gift of the time with the patient. So I think it's kind of our job to do the most thorough assessment that we can for the doctor. When the doctor comes in, we've already gathered as much information as we possibly can so that then they can make quicker decisions on where to go with treatment. If we're not doing those assessments, the exam's going to be slower. The patient's not going to be like preheated as to like what's already going on in their mouth. And I think it's just this bottleneck of at the end of the appointment, the doctor's kind of frazzled trying to make a quick decision on what's needed because he knows he needs to get out of the room or she needs to get out of the room. And so I do think assessments are probably the most important thing that we do as hygienists for the big picture.
Mm-hmm. Yeah. Which once again comes down to preparedness. Like that's the funny thing. It's just being prepared for every step of those appointments as much as you possibly, I think, can. One thing, Amy, too, that I think is really important to highlight is in that 20-minute assessment, hygienists being truly calibrated on what to do when they have certain findings in that assessment. Mm-hmm. One thing that I don't know about you, but when I talk to doctors is, their perio percentage is really low. There's a lot of patients walking around with unhealthy gums, but the hygienist kind of quickly jumps in, does the same thing they've always done. They do the bloody prophies over and over and over. And what's funny is that the hygienist doesn't feel great about it. The patient probably doesn't even know that they have this. And once again, I think to kind of say in that 20-minute assessment, if you're spending the time to really assess, you're seeing things like perio much clearer, but it's important that all the hygienists have an extremely clear baseline for what is periodontal disease and what's not, and then what to do when they see certain things. Like I know for Amy, it's almost like a game of like, okay, we see a 4 bleeding. What do we do? And it's like all the hygienists should have a very similar answer. Yeah. So what have you seen as to why it's so important? Can you expand upon it that if you can, I guess I should say.
Well, I think if you're going to do a same day, like 4346 code, you have to know, like, if I see this, this, and this is what this means. Like you have to do the work on the front end. And we spent a lot of time coming up with our perio protocol, and we defined what is a healthy mouth cleaning to us. And then, we move on to the 4346, like what do we have to have for it to be that? And then if it is that, what else do we add? Like laser with the 4346, obviously fluoride, I'm going to bring that up every time. And then if we're going to scaling and root planing, we just have very defined, so we have consistency of care. If a patient is seeing me one time and another hygienist the next time, that next visit, the patient's not going to hear that they have periodontal disease for the first time. It's so important that you have those defined things. And then we just, as a profession in general, we have to stop accepting bloody prophies. Like that bacteria that is on the teeth, it's releasing toxins into people's systems. And I mean, I think we need to take it more seriously maybe than we have, and make sure to educate patients that, there is a lot more to this inflammation in the mouth than what just bleeding gums when you come get your teeth cleaned or when you floss. It's yes, it takes a little bit of time to have those conversations with our patients, but it's super important. And then with those perio protocols, we also came up with, we use Open Dental in our practice, but we came up with quick buttons that if it's going to be like a 4346 code, we can just click on that, like a quick button, and it's got the 4346, the laser, and the fluoride all attached. So I have to click one button to make a treatment plan, So it can be super quick. Like it doesn't have to, take a lot of time, but you can send that to the front. They can kind of do the breakdown, come back to the op, sign off on it, and you're good to go. So I do think back to being prepared, it's got to be easy too to incorporate it in there.
Yeah.
So, and I do think it does. We took a lot of time as a hygiene department to kind of work together to figure out what we wanted our perio protocol to look like, and then you got to be in agreement. All the hygienists have to be on board, and they have to believe in it, and that's from there. It's easy to implement because it's just the way it's done.
Yeah. And it takes the guesswork. Like I always think to myself, like we've got newer hygienists, and especially now, like a lot of us have new hygienists, we have temp hygienists, and Amy makes sure that whether you're a temp hygienist, and I'm talking about like we have some long-term temps, and she makes sure that they know that perio policy as well. Like these are our protocols. This is healthy. This is not healthy. So it doesn't matter, which hygienist it is. They know walking into that appointment, if I see blank, then I do blank. And it takes that guesswork out, and it becomes the standard of care in your office. So your hygienists don't have to try to figure out, do I just accommodate the patient? I don't want to hear the no. Where I feel like Amy has so established with our hygienists, like there's not really a choice. Like this is what we have an obligation to present. We have to tell the patient this, almost like she's so emphatic about like this, we have to tell them. So all the hygienists it takes the guesswork out when you have a really solid policy, and then it makes it easy when you set up those quick buttons so your hygienist can be in that appointment and do it quickly, which, kind of moves me beautifully into my next point of like, I assume that during your 20-minute assessment, that's the time where you've had your level of preparedness, but you're in your 20-minute assessment. You're really kind of determining how to get them well in that 20-minute assessment, and that's when you're deciding what adjunctives make the best sense for that patient. Is that correct?
Yeah.
Okay.
A lot of times though, I'll go into the day already with my prepping, knowing what I might add, but a lot of times a patient will come in with something new that you're not maybe able to foresee, but of course you may change direction, but those assessments are going to just spark any opportunities that you can add. Gosh, I don't know. There's just so many things that you could add depending on what you're seeing, and the conversation that you're having with the patient at the same time. So like, I think asking questions of the patient as you're doing the assessments too kind of brings them into it, and kind of what's important to them. So maybe they want whiter teeth, or
that's what I was going to ask. What are some of the questions that kind of help to pull them in?
They have sensitivity. Oh gosh, I'm trying to think. Dry mouth. I don't know. Just
right. I know. I'm like, gosh, I think about like I would say like the adjunctives that I think I see the most when I kind of print everything out is perio, 1 to 3, gingivitis, and I don't think that's adjunctive. I'm saying just like what I see beyond, traditional 1110s. Laser, obviously a lot. I see obviously night guards. We do an in-office what we call a Prophy Plus, which is called Smile Perfected. So it's like a 20-minute in-office whitening treatment for patients that just they tack on to their Prophys, and then they just try to schedule that every 6 months with the patient. I'm trying to think what else you guys do.
We'll take impressions for guards. Yeah. Or if we're doing an in-office guard that we make in the lab, we'll take an impression. We'll do in-office whitening trays. We'll take impressions for those. We'll scan for guards if they want, a lab-made one.
Yeah, I was going to say like HPV testing. There's, I mean, like you said, a lot of dry mouth therapies you can do. I think the main thing is though, like there can't be barriers to using them, and I'm guessing, Amy, because we've implemented a lot, obviously, these things, like, what are some of the barriers for hygienists who are out there right now wanting to use these things? What are barriers? What makes it easy? What should doctors know? What makes things easy and what makes it hard?
Yeah, I think the biggest thing is having things within arm's reach. So you have to figure out what's going to work. You have to have intraoral cameras in each operatory, because that just should be part of the assessment, no matter what. And so if it's easy to grab, if you're not sharing it with somebody else where you have to get up, go get it. I mean, that truly, that minute, it's just, oh, if you have to get up, that might be something that you're going to blow off. Like sealants, we forgot sealants. You can add same day sealants. We have like, our top drawer has like all the things we use in a regular recare visit. Our next drawer down has sealants. It's got anesthetic. It's got syringes. It's got Orachix. It's got everything that we might need for adding a same day SRP. It's got, I'm trying to think of all the other things that I think it just has to be easy. If it's not easy, it's not going to happen. And so you do have to kind of do some planning. We used to have to stop what we were doing, get up, go to the back, go to the lab, kind of gather all the stuff that you need. And the clock's ticking, so the more that you're out of the chair actually doing, you're just losing that time that you could be productive and actually making the patient healthy.
Yeah. And that brings up such a good point. And I don't, Ash, like, I don't want to be like, I'll just use myself as an example. I used to kind of be like, well, I don't understand why you can't just do this and you can't just do that. And like, don't you care? And like, and then when I really watched, she would be getting up 7 times to then go try to get this. And then like, well, the laser's over in op 6 and then this is over here. And I'm not advocating buying everything under the sun. That's not what I'm saying either. But when I made it easy and then I set the expectation with her of like, okay, now we have this right here. Let's see what we can actually do with it. That's what really like catapulted her, I feel like, to like next level hygienist. And I'll also include like the laser that we love, that we use, that, I mean, literally every day. And all our hygienists are trained on that. And it's right there. And I know you like her operatory is connected to another, and they share that laser just back and forth. And then I have the same thing for the other 2 hygienists where it just kind of gets in the main practice. That's kind of what they do. So I'm not advocating like an iTero and laser for every hygienist, unless it makes sense. Maybe, I don't know. But I am saying though that like if it's really difficult, if they have to get up and walk around, like I used to be like, gosh darn it, like why can't you just do this? And it was like, well, because that was 10 minutes of her time looking around that she just wasted, that she could have been with the patients. And so when I was really honest, I was like, okay, let's figure out how to make this easier and then set expectation to using the product. So have you seen that though, Ashley, too?
Well, yeah. And I think that kind of goes back, right? Like they need 20 minutes to kind of go through these things. So let's make everything as efficient as possible. That 10 minutes that they're spending is like, that costs you more too. Like that adds up. So I think that's a super crucial, I mean, of course at DSN, we're all about efficiency and systems. So just make it as efficient as you can, any minute that you have to step away, it's same as a doctor, same as a dentist, your most valuable time is right next to that chair. And that's the same for those hygienists. So I think that's a really important thing to note and take. Yeah.
It's not too costly to have etchant and sealant right there. It's not too costly to have anesthetic there. And like I said, if you can even start with potentially think about 1 laser and have it just right there available, like it's pretty neat.
We put one on a cart, like a rolly cart, so it's easy to move from room to room, and all you got to do is plug it, and on the cart it's set up and ready to go. So it can be shared, and it's not that difficult to move. And then we took it a step further now, and we have like a really easy one that's just one piece that's
nice.
I don't know, really easy to move from op to op. But
which I'll post that because I often get questions about that and like, is it really worth it? And, cost wise, all that good stuff. So I'll post that as well. But I mean, I think to reiterate, like in exactly like you said, Ashley, like Amy literally spends every second of that 60 minutes she has, every second, and sometimes 60 seconds more because she just cares so much. And so she utilizes every bit of time, but you're right, Ash, like it's right there with the patient. So the patient feels extremely well, I think, cared for by
Mhm.
Amy as well. She's by far the most named person in our Google reviews in this office. So they feel very well taken care of by her. So, well, and speaking of care, like I know how much you care about, and this is a question I get, is hygiene doctor exams going really well, not for even the production sake, but you care so much about that hygiene doctor exam going well for the sake of the patient.
Mhm.
Elaborate for people who might be listening. What do you see as things that work really well? What are things that maybe don't work as well, perhaps?
Gosh, I think if every team could just recognize that those doctor hygiene exams are like a massive zone of opportunity to lead our patients into making decisions that'll get them to optimal wellness, not just their oral health, but a lot of what we do in dentistry can affect their overall health. But I think great exams are the ones where the doctor and the hygienist are calibrated really well. I think it's so important to take the time to calibrate and know, like, I want to know how I can prep the patient for when the doctor comes in, and just let them know, like, usually in these situations, doctor will recommend this. I'm, like I said before, I don't diagnose, but the patient has a pretty good idea of what they're going to need when the doctor comes in. They're not hearing it for the first time from the doctor. And I think if you can get in a routine of, a little bit of small talk when the doctor comes in, and then kind of getting into the exam, it's like talking to the patient as the doctor's looking at everything, and then a conversation between the doctor hygienist. And that conversation is going to be very similar to whatever the co-discovery was with the patient at the end of the assessment. So they're hearing it again, what I was seeing. The doctor's asking, how is soft tissue? How is hard tissue? And then, just doctors having the confidence to make decisions, and just, telling the patient what they need, and then taking the time to really let them know, like, why it's important. I think that shows that the doctor cares about the treatment, not just or the patient getting healthy, and not just the treatment getting scheduled. It's a not a very big time thing, but I think it goes a long way in wrapping up the appointment, just to have the patient feel that it's not just about, I don't know, scheduling the crown or whatever. And I don't know if I'm explaining that well, but
Well, and yeah, I mean, I don't want to
Yeah.
interrupt, but I mean, I think the point being too, and we just had a leadership meeting. We were kind of discussing this too, that
I was about to say that goes to leadership. I think we're on the same page. Go ahead.
well, and it's so funny because it's like, I think that like leading the patient through that appointment and helping them understand where you're going and why you're going there makes such a big difference. And if, the doctor and hygienist are on a team kind of co-piloting this, they're looking to us to really help them understand and where to go and when and why. And like she said, there's this line though too between I recommend a crown, get that scheduled, versus, hey Bob, I completely understand that you love to hike 14ers on the weekend. We live in Colorado, Ash. That's what people, of course, do.
Yeah, that's what we do. That's what we do.
We don't here, but I know you love to hike 14ers, and I'm going to be honest, I'm really concerned that, like Amy showed you on that picture, that crack is such that, gosh, you're going to bite something wrong while you're hiking. I'm really scared it's going to fracture. And until you can come in and you can get that done, Bob, I need you to be really careful chewing on that side. I'm really worried about that.
Mm-hmm.
And I think like patients can actually feel that level of like, I truly care that this something terrible could happen, and I'm worried it's going to happen with you when you're doing the things you love somewhere where I can't help you.
Right.
And I don't know if that's kind of what you were saying, but like, I don't know. I think sometimes, and I tell my doctors all the time, like we forget that that's the first time the patient is seeing us, in 6 months and getting this information. And I'm always like, give them everything you've got. And I don't mean giving them everything you've got with lengthy, you know.
Let's talk about that football game. Or,
Yeah. And then talking about like buccal mesial, you know,
God.
whatever. I don't necessarily think that's what I'm saying, but like when you see the space, talk about it. When you see the occlusion, talk about it. Give them everything you've got and let that patient make the best decision for themselves. But what's crazy is I think in exams, we shy away from telling people the truth. And I think we shy away from just giving them what we know and explaining that level of care to them. And I think for hygienists, we didn't obviously rehearse this, so I'm truly asking, but like, I feel like hygienists love doctors that care that deeply. Like, I think their commitment level to that assessment stays stronger when they see their doctors utilizing it. They took that information, they handed it off in that exam. So doctor, you know, and they're going through the exam card. Like I said, we have exam cards. So no matter what doctor walks in, they look at that exam card and they have all the information that they really need to know right there. And that doctor uses the information they gathered to help, again, kind of walk through everything with the patient, and they don't miss anything. Soft tissue, hard tissue, occlusion, you know, oral cancer screening. We go through all of that and we can do it succinctly, but I think the patient can detect when that level of expertise and care is consistently happening. I think they feel it. And whether they say yes or no, you know, we're not married to the result, but we do want to ensure that they understand, I think, in those exams. And I think the hygiene doctor exam is, like I say all the time, like one of the most overlooked parts of a practice that have the biggest impact.
Sure.
And I teach so often, like our doctors, like everything starts right there.
Yeah.
And I think it's so important to try, you know, for so long, Amy and I have tried perfecting that as much as we can and making it better and better. And I do think it's a craft that if you're not working on, I think it's easy to get into habits that maybe aren't good for our patients. So
sure.
Our doctors are pretty good about letting us give them feedback, you know, like, hey, that verbiage was awesome, or hey, maybe take that one out of the routine. And then the other big one that I wanted to mention is, like, I know doctors are on a time crunch, and usually those hygiene exams are like, oh, I don't have time for it. But I think just taking a moment before you go into that hygiene room, taking a deep breath, trying to just like let go of whatever's happening in option 3 or whatever, and then just pour yourself into that exam just for, you know, that 3 to 5 minutes that you're in there. Like, just really be there. Like, try to really focus on what you're doing there. And I think that goes a long way too, because the patients can feel when you're like, I don't have time for this.
Yeah, or they feel like a burden, right? Like they're a burden on your time. Like you came in to be seen about your health, and now you're a burden on their time. I think they can definitely feel that.
Yeah. I mean, we've all been on the other side of that.
Yeah.
Fans rushed things when they didn't listen. And, you know, I know Alistair, a friend of all of us, I mean, like, really your gift of focused time is like a rare commodity nowadays. And I do find that when I'm like, I always tell our doctors, like, they don't know what's happening in op 3. Like, they're here to see you, and giving them that focused time, like, it makes a world of difference. And like I said, whether they say yes or no, they'll know you care, which for us, I think is like probably the biggest thing. So,
and also
I think too,
today doesn't mean no tomorrow. Like, you know, I think we got to keep having those same conversations, even if they said no to the treatment the last time. It's our job to let that patient know why it's recommended. Yeah, and I'm sorry I interrupted you.
No, totally. No, I'm just on that exact same page. And I think something, it's kind of one of a couple things. One, when like you mentioned, when the patient understands why, you know, I think they're more willing to invest, you know, like that they can truly feel like they're investing in their health when they understand why it's happening. I forgot what my second point was, but you know, but that info, you know, kind of the knowledge is power. Oh, like the repeat conversations. You know, I think too, when you've brought it up a couple of times, you know, then they're starting to think about it a little bit more. They're starting, you know, it comes back around. So they can also feel when you're like, no, you really need this, and like you're trying to push it versus the listen, I want you to make the decision, because I am 100% more likely to say yes to something that was my choice versus something I feel like is being forced on me, whether it's for my health or not, and whether they have the best intentions or not, like I want to make the call, I think. And I think the patients feel that.
Yeah, I couldn't agree more. Like they want to actually invest in often, their health, their beauty, their wellness. And we're just co-diagnosers. We just get to educate them on that. We just get to give them everything, like I said, we've got, and then they make the best decision. Right. And that's always how I leave it. Like the exams that I feel the yuckiest about are the ones that I didn't. The ones that I felt like, maybe I just won't say anything. And it's like, gosh, like, what if I was just better at communicating? What if I was just better at, helping a patient understand it? And whether they did or, not want to do the treatment is up to them. But I gave them that option. I always feel better about that, I think. Well, and a question I know we got, Amy, was speaking of creating value, is, when you're discussing laser therapy with a patient, you've prepped before, you've looked at their charts before, so you're not surprised when you're going to usually talk to them about it. But how do you talk to them about the laser and why to use it, like with gingivitis, inflammation, things like that? Which is funny because Amy always likes to, yes, she's like, okay.
So usually what I'll say is, I'm still seeing the bleeding that we talked about last visit. I would like to use some laser therapy today. What it is a light that's just going to go in. It's going to take the bacterial count from in the millions down to the hundreds, and it's also going to stimulate healing.
That's it.
I don't go into like crazy detail. And most patients are like, oh yeah, like, okay, cool.
Yeah.
Like a laser. Like, and I, I rarely get no. And I would like to think it sounds a lot better when I'm saying it to my patient than it just did now, but I think that is pretty close to how I say it.
Yeah, I think so.
I think keeping it simple, and to the, kind of to the point. We have some incredibly brilliant docs, but I've had things explained to me sometimes, and I'm just like, listen, I thought that was cool, but I have an anatomy degree, so that's why I thought it was cool. But I don't think that this is going to work with every, college kid who comes in, every grandma, every, like right. You have to get to the point, It's and the kiss thing.
Even the patient's like, what did they just say?
Yeah.
I know.
Like, okay.
I don't know, some sort of laser. Yeah. If they want more information, our hygienists really do know information. They'll ask.
Sure.
Tell me more about it. But I would say 85-90% of people, they want to know it stimulates healing and it's going to take the bacteria count down, and that's exactly what you need to start jump-starting, you to health. That's it. That's what they need to know.
Sure.
So that's kind of how I think Amy kind of goes into that. One question that I get, and I get often also, is KPIs. We all have KPIs per department. The hygienists have them as well. We spend a whole quarter hyper-focused on specific KPIs just to ensure that we've kind of solidified their consistency and things like that. But, one thing that we, I apologize. Sorry, I just read something. I lose my train of thought. One of the KPIs that we track, that's what I was trying to say, is the treatment that comes out of all of the operatories. We like to know, like, what combo is working as far as hygienist doctor, this treatment coordinator, things like that. So one of the KPIs for the hygienist is how much is being treatment planned out of the room. Well, we all know that that's part them, part doctor, but we just like, to kind of see what that looks like. She has KPIs for wellness scans, perio percentages, things like that. Amy, I do hear, like I said, one of the questions I get is, so you're tracking, like, how do you even talk to them about tracking KPIs? Or my hygienists aren't going to want to do that. Or they say they don't have time for anything. Or, I know for you've kind of switched so much to understanding what the numbers mean. So what do you tell other hygienists who say things like that? Or when hygienists come on board with us about KPIs?
I always try to like explain that, you know, the dental office is a business. The hygiene team, we are probably one of the biggest expenses. So in that, we need to be sure that we are contributing every which way we can to the success of the practice. That means we are doing those awesome assessments. We're figuring out what needs to be done, and then we're really backing the doctor up on the treatment that needs to be done. I think it's important for them to know, like, if you're given the gift of 60 minutes and you're getting paid a hygiene wage, that hour isn't going to be just a walk in the park. You're not going to do 4 bite wings and a prophy and, you know, send your patient out. Like, I think I about have a heart attack every time I see a 60-minute recall patient being walked out at like 30 after. I'm like, where are they going? Like, did they take oral photos? Did they do a wellness scan? Like, I know they're like, I use the whole hour. Doesn't matter how, you know, like usually the patient's here the whole hour. But I think yes, it's a business. We need to be productive. And then also, like, I find the KPIs as kind of a scorecard for myself and making sure that I'm offering everything that I can possibly offer to the patients that I know is going to make them healthy. The easy way is to just, you know, do what I've always done, the 4 bite wings, the prophy, and not have the conversations about this is why fluoride's important. This is why I think you would benefit from the laser. I think we should stop right here. We need to change gears and maybe start treating this bleeding that is going on instead of just seeing you every 6 months and having the same thing going on. Like, we have to actually check ourselves. If we know that 50 to 60% of the population in our country has periodontal disease, like, our KPI should reflect that. Like, adult patients that we're seeing, we should, you know, 40% is still maybe on the low end of where we should be. But like I said, it's a scorecard and it's kind of checking ourselves. Like, are we being true to what is needing to be done? And if not, like, let's start working on making sure that we are calling it what it is. If it is perio, if it is scaling with inflammation, like, let's not just keep doing the same thing over. I just read an interesting statistic. I think it was an RDH magazine that the perio numbers have gone up from like 1991 to now, but by like 50% and they're projecting that it's going to go up even more. So, like, obviously what we've been doing is not working. We need to be more proactive. We need to start, treating it as we see it. And the production numbers, the goals, the KPIs, all of that is just a scorecard. It's not, I think we get so wrapped up in like, the doctor just wants me to make more money for him and it's, there's just so much more to it than just that number. Like, I don't feel like I'm doing the office a good service if I'm not producing 3 times or 3.3 times my salary, because I know that I'm an expense. Like, for us to be successful, like, I need to be hitting those numbers.
I think too, like, kind of to that point as well, I love what you said about, listen, I'm going to use my whole hour. Like, I think and I'm just assuming here, but, you know, as an educated healthcare provider, you know that you have information and skill that can help this person be healthy. And like you said, it's, you know, 40, 50, 60% of the population. And you know that there's probably something, it's your obligation, right? To use that time to get them as healthy as they can. If someone is, you know, overweight and obese and going to the doctor, they're going to tell them, hey, I'm seeing this and here's what we need to do to correct it. You know, it's not just, let's take your blood pressure. It looks okay. You know, let's see where you're at. And, you know, the doctor is going to take that time and say those types of things. In a good doctor will, but that's kind of what I loved, that you're like, listen, I'm going to use that hour for no matter the patient, because there's probably something that I can do and teach and share and use to help get them healthier.
Yeah. Oh, absolutely. Like, such a great point. Like, gosh, you know, like, most people who know, like, I've had like multiple hip surgeries, and I use my hip surgeries as a funny like analogy too, of like, I can't imagine going in and him just being like, I mean, whatever, it's always out of place in your ligaments.
Have you tried ibuprofen?
fine. I'm just going to go ahead and put a giant bandage on it. Like,
Yeah.
good luck. You know,
Yeah.
I would be like, give me options, like
Mhm.
help to, and one, I need to know that there's a problem. You know,
Mhm.
just feel like people are walking around with periodontal disease, and like that's a startling statistic. Like what we're doing now as kind of, you know, collaboratively in hygiene maybe isn't working for the best of the patient. And like, as we all know, with systemic things happening, like it's really doing nobody service, and it's actually detrimental to their health. Like you
Sure.
said, it's one of those insidious things that's a slow process that it's like, golly, we could catch early and let them have the option to help get themselves healthy sooner than later. Who
Do
doesn't want
you, maybe I want to have like a rainbow version of this too. Is it possible too that number has gone up since the 90s because people are diagnosing it more as well? You know what I mean? Like, do you think that more hygienists are taking ownership of it and diagnosing it more? I know it's still like we're still lacking in diagnosing, but
right.
Is that possible?
Maybe it could be, right? And probably we would have to dig into that, because you're right. Who knows?
Just curious.
But, yeah, right. There's a million. Absolutely. That would be my hope for sure. But regardless, like, how many times do you see offices, Ashley, that it's like just severely underdiagnosing, you know?
Yes.
And it usually isn't because hygienists don't want to. I actually believe the opposite. I think it's that hygienists just don't have a clear expectation of what to do. And if they understood the why behind it, that's why I said why that perio protocol, why all the preparedness of making sure that your hygienists are collaborative and understanding that, I think that makes the difference, you know, as far as them understanding why that KPI is important.
Yeah.
And I think, you know, for us, I think the hygienists who join us were also very honest and open about what hygienists excel here and which ones probably won't love it. So we ensure that from the get-go, you know, when Amy does, you know, they have working interviews, and Amy will sit with them at lunch and make sure they know this is the kind of office we are. This is what we're about. Here's the onboarding packet. And she kind of walks through some areas of like, this is what will be expected, because this is how we get our patients healthy. And what's crazy is, you know, during COVID, we've been so blessed to pull some hygienists actually who are like,
Awesome.
I want that.
Yeah,
I don't,
That's amazing.
you know, and so we didn't poach anybody, for the record, but
This is live.
I know, that's what people just answered.
I think another thing that's really helpful though is if like the hygienist feels that ultimately the most important thing to the doctor is the care of the patient, like that's so much easier to get on board with, like why the production goals are where they're at, like because they know it's not really about the money. It's
right.
It's about, are we offering these things to the patient that they need? Like I think that does take a little bit, maybe getting to the heart of it instead of just the numbers. That goes a long ways, I think, for a lot of hygienists, because if a hygienist thinks it's all about the money, I think that's when they shut down, and then they really don't want to do that.
Well, then it becomes all about the money for them, right? Why would I work harder if I'm just gonna, you know, when I could just do a bite wing and a bloody prophy and call it a day? You know, if that's all this office cares about, why should I put that effort forth as well? I mean, it goes back to culture and leadership, and you know, it all kind of trickles down.
Yeah. Well, and one of our KPIs is the scans, the wellness scans, and we don't charge for those, so that's not adding to our, you know, our production for the day, but it's such an awesome tool, like to educate the patient, that I think that all of us are on board to do it, even though it's not really helping our day look any better. But you know, it's, so that right there just goes to show it's not just about the money, you know, it's
it's about hygienists wanting to work with tools that help get the patients healthy. So I do think, like, for us, the KPIs, I think it's something we prep everybody who joins. We don't surprise them when they come in. We slowly ramp them up to the KPIs, and we make sure that over their 90-day onboarding, they understand the why behind them. And then, like, you know, we literally just got done discussing this in our leadership meeting of, like, for some new team members, whether it be hygiene or other, they like numbers because they like goals and numbers, like they just like that, right? But there's a lot of team members, I said, that, you know, for them, it's all heart. And so connecting their heart to the numbers connecting, like, and we always say, like, start with the why, but no, really, like, connecting them to that number and what it means impact for the patients. I can't stress that strongly enough. That's how, with, team members, I think they understand then, oh, when I do this KPI, when I hit it, it means maximum impact for the patients. It means maximum wellness. It means maximum health. Like, I think that's something that I know as our leadership team, we're kind of constantly trying to stress when it comes to the numbers and KPIs, is connecting their heart to it. So, for final discussion points, I know that, and it's funny because we're going to be having like an all kind of company picnic, and each of the department heads is going to present something to discuss with everybody. And it's almost like what you didn't know, right, about our department. And Amy, one thing she is really passionate about is like a really good hygiene program. It incorporates the entire office. It's all about the whole office. And so I'm going to let her, as kind of a final point, expand upon that. And then we'll make sure to touch on any potential questions, Ash, that we didn't get to, but I'll let you kind of take it away.
Well, I think for me, I want to take ownership with the team to make sure that, like, if you're in the front, answering phone calls, scheduling the day, if you're an assistant, if anywhere you are on the team, that we all are on the same page and we know what a healthy mouth is. And that's not just like no perio, that's not just no cavities, that's a good bite, that's a white smile that you're proud to show off. Like, there's so much more to it than just perio cavities and crooked teeth or whatever. So if everybody is on the same page with that, I think somebody calling to cancel their scaling and root planing, that front office person is going to be like, oh. And then also, I'm going to back up a little bit, tying it to the oral systemic link. Like, this infection in your mouth is actually setting you up for being more at risk for so many things. I think they keep finding more as time goes on. The toxins that are being released into our body, they're actually finding are also like carcinogens, they're causing cancer. So I just think an empowered team that can know what a healthy mouth is so much more useful than us all being on our own base and kind of like in our own little world. Like, I want to know like what I can do to make the front office's jobs as easy as possible, and they can also feed into the hygiene program by just having the knowledge and being able to really help us, encourage those patients to keep those appointments because they are so important. And then like we've actually incorporated recently, like even the assistants come to that morning huddle knowing what patients have not been in for their recare, which ones aren't scheduled. And we know that day if somebody falls off the schedule, we may have a patient in the office right there that we could slide over to our schedule. And those assistants are actually even on board with, feeding those patients into hygiene if needed. Like, it's just the whole big picture. And I think, everybody being in agreement on what a healthy mouth is, and then like that's what we're going.
That's your cornerstone, right? Like, yeah. That's why everyone's in this industry, especially as dental. I mean, that's the cornerstone.
Yeah. And it's so true. Like we were saying, like, it is so important that if, they don't all connect to the cause and the mission of like what we're trying to accomplish, they don't even know how they can impact each other. Like you said, if we're all kind of on our own base, then I think really for the patient's sake, we're once again not working as a collaborative team to get them as healthy as we could be. And I know a lot of offices, to kind of piggyback on that, they're experiencing cancellations or experiencing, patients dropping off due to COVID, due to kids going back to school, whatever. But I've just heard that a lot of people are struggling with, unfilled schedules. And working together collaborative as a team in that morning huddle, like she said, like we're all looking at our own column and figuring out who's due for recare or perio right now. We block that out on the schedule. So every single column has a block either above it or below it on their column of all the people in that day that are due right now. So if something falls off, our front office is like, ooh, I'm going to pull from Lisa's column. I'm going to pull from Amy's column. I'm going to pull from Hannah's column. And so it's been a nice way to kind of keep the schedule full when because things do happen, and with things so unpredictable right now, I know despite our best efforts, we're seeing it too, for sure. So having a plan in that morning huddle has been for sure helpful, but it takes the whole team understanding how important it is to keep people in the hygiene program, for sure, to keep them healthy, and knowing that those baselines, for sure. So Amy, one question I know that maybe we want to just real quick expand upon is, what time limit per patient do you have for adults, children, new patients, SRP?
Yeah, so adults, we get 60 minutes. Children, we do if it's a new patient child, we do 40 minutes, but recall children, we do 30 minutes. New patients are 90 minutes. And if we're doing a half mouth SRP of full quads, we get 90 minutes. If it's a half mouth of 1 to 3 teeth, we get 60 minutes. And then, am I forgetting any?
I know. I'm like, what if you had I know the answer, but what if you had a 1 to 3 teeth only quad?
I would try to fit that in with the prophy on the same day, like that day.
If you had one quad.
Yeah, 1 to 3 teeth, 1 quad.
Yeah. 13 and under 30 minutes?
Usually, yeah. If they're new, we usually will do the 40 minutes, but if they're recare, we can usually do 30 minutes. And then those ones are easier to have another appointment against it. The 40-minute ones get a little bit wonky.
Yeah.
So.
Which does go to show though too that we're pretty stringent about blocking things out appropriately, because we refuse to have any like 10-minute wasted times. So we're pretty good about, like, if they can't fit something in that day, they search for sometimes those little tiny appointments to finish things up, just to ensure that we utilize every 10-minute we have. So same day sealants, they do as much same day treatment of small things like that.
Yeah, we have like isolites in our room, so like during the prophy we can add those in after the exam, and the sealant material, etch, all of that is right there.
Awesome.
For sure. Yeah. So, well, thank you, Amy. I am so grateful to you. Every time when she talks and she does these, I'm just like, oh my gosh.
You're a lucky lady, Summer.
Oh, I don't know, like people are like, always like, where do I find an Amy? Where do I find a Debbie? And I'm like, I know. I'm so grateful. She's just amazing. Like, I can't stress it enough. Like, she's
amazing too.
She's like every bit of awesome that she sounds like. I'm like, oh my gosh. But what I will do is I'm gonna try to get to you, Ash, just to post with this, the morning huddle prep sheet. The doctor exam sheet that Amy uses, all our hygienists use for every doctor before they come into the exam. She's going to get you the 20-20-20 breakdown of how that 60-minute appointment looks like. What's a 20-minute assessment? What's it all look like, and what does it break down to? I will get you the information on the laser that we use in hygiene for them to be able to quickly use the laser. And then the other thing is I can post this again, but I did see that the Front Office Academy just posted. I can post the QA card we use. Like Amy said, I do love it when the hygienists use a scorecard to help doctors understand what to do better in their exams. And so that QA card, I know that the hygienists use, and sometimes like my practice director will use, and she'll go listen to exams and kind of give the doctor feedback according to kind of a rubric. I did see that the Front Office Academy just posted that same QA form.
We'll put it in here too, just so people aren't looking around in different spots. So just shoot it over to me and we'll put it in this too.
Perfect. So I'll incorporate that. And then I think that's kind of a lot of what we discussed in paper form, kind of tangible. So
Cool.
Hopefully that will be helpful. And then, let us know if there's any other questions beyond that. But thank you, Ash, for your time. I appreciate it very much.
Oh, no, thank you, ladies. And Amy, thank you so much for again joining us here on our Lady Leaders webinar series. We'll be coming at you next month with some more. Laura, great to see you. Thanks for everyone who tuned in live. And everyone have a great day.
Awesome.
Thanks.
Thank you guys. Bye.
Thank you guys. Bye.